Welcome to a Healthy Living video blog at workoutmaster.com. This is Ruben.
And this is Aram.
Today we have another exciting episode for you. We're going to talk about back pain, and back pain is a humongous issue that affects majority of population of this planet. What are the statistics? At least 1 in 2 or more than 1 in 2 will experience back pain at some point in their lifetime, so it's a huge topic. We're going to separate this topic in different parts. So what we're going to talk today about is about root cause of the problem.
Yes, it's very important to identify where the pain is coming from, not where it's at. We always know that it's in your lower back that's hurting, but to identify what could be the root cause of the issue, and there's many and various ones, and we would like to point out the characteristics of each of them. We'll probably do it in subsequent episodes. But it's very important to identify exactly where it comes from, because then you can take an upper hand on the situation, do something about it, not just rely on the very helpful sometimes, offer that, that your doctor, your chiropractor, or whoever, is in your healthcare, will address you as.
Absolutely. Ruben and I are corrective exercise specialists. We've been trained within the C.H.E.K Institute system specifically for corrective exercise for back pain rehabilitation. So we basically, our specialty, even though we talk a lot about nutrition, exercise, is back rehabilitation. Yeah, you have a lot of clients that you work with. I had a lot of clients, including doctors. We helped with the back pain, so we do know what we're talking about here.
Oh yeah,
for sure.
Absolutely.
Okay, modern perspective on the back pain. If you go to the doctor, there's two different solutions that modern medicine offers for back patients. Number one is a medication. It usually has something to do with the painkillers, or muscle relaxants, or anti-inflammatory. Basically, it deals with the pain per se, does not deal with the root cause of the problem. You just don't feel a pain, which can be a problem on its own. Number two solution is a surgery. Some people do definitely qualify for surgery, and it's a must take action. Other people are not necessarily need the surgery, so they kind of end up being in this limbo state. Doctor does not want to do a surgery, yet there's nothing else that they generally know that helps. So let's talk about what are the possible driving causes of the problem.
And getting back to what you just finished saying, oftentimes medication only takes care of the symptoms, and they keep reproducing over a period of time. They'll have the same symptoms over and over. And surgery, they're not in such a bad case that the doctor wants to risk doing surgery.
Regardless of the fact if they do surgery or not, you still have to do something after the surgery.
Right, and
exactly what we do.
What can happen is, in that situation, they might refer them to physical therapy. Well, if they happen to fall in the hands of a good physical therapist, such as Dan Hellman, well, guess what? They're in good hands, and they're going to do really, really good. If they go to other physical therapists that are not so good, and they're following, this is what hurts, and this is what we're going to focus all our energy, guess what? You might miss the whole picture by a long shot. And then what you're going to have is a revolving door in your business, where you have patients coming in and coming out, and they're not really getting better. They're only reducing the symptoms a little bit, but as far as to return to that point where they're strong and stable in regards to prior to the pain bouts that they were having, they're not.
Absolutely. Right? Now, the major problem with the back pain, or root cause of the back pain problem, is visceral-somatic reflex. Let's talk a little about it.
That's quite a mouthful. Visceral-somatic reflex. That means visceral, your organs and glands. Somatic means your muscles. So what it pretty much means in simple terms is that oftentimes organs and glands can get overburdened, or they're not working functionally, or they're not working, or they're overworking. So what happens? All the energy that gets created, it will be dumped into the muscles, because these muscles are the most metabolically active of all the tissue that we have in our body, for the exception of our brain and heart. And what happens is that as the body dumps the energy, what it's trying to do is just ameliorate the function of those organs. Don't forget that you cannot live without organs and glands, but you can do without a lot of the muscles in our body. So the body's kind of prioritizing its energy resources. And in that effort, once the muscle gets overloaded, it will start to have pain due to the process of possible inflammation. And when it gets actually inflamed and it gets overburdened, due to the pain reflex, it will stop immediately, because pain inhibits function. That means that it does not work. It inhibits.
So it inhibits the muscle, and that destabilizes the whole structure.
Well, yes, that's the next part of that.
Okay. Now, the second reason why people have a back pain is because of some sort of biomechanical postural difficulties. Has something to do with your daily activities. It could be a sport. It could be just sitting around. Whatever you guys do every day has an ability to create a dysfunctional pattern, and that dysfunctional pattern eventually can come up as a back pain, and it's very important to identify such a thing.
Yes.
Yeah? So it doesn't have, you don't have to be an athlete to end up with back pain, obviously. If you're an office worker or a desk jockey and you have to sit for extended period of time, you can have a high chance of back pain.
Right.
Same goes for somebody like a cashier who moves in one direction all the time, or a nurse or a UPS driver that have to deal with a weight and lifting the weight, or grandmother if you have a child.
Right. Or it could be somebody that goes to the gym and in the name of health, they go there to do a workout and they end up training incorrectly, or they just overloading their body with more weight that that the body can tolerate, and that in itself will cause trauma to the body.
Yes.
And lead to many other pains and dysfunctions.
Correct. Number three, it could be gender related. Believe it or not, just because you're a female, you might possibly get a back pain just because of that.
Absolutely. It is a well-known fact that females suffer from more back pain than males for the most part. Not so much on the chronic phase, but in the periodic or temporary pain. And oftentimes this happens just due to menstrual, the cycle. As you well know, I don't have to tell you, obviously I don't have a uterus, but you do have one, and when that thing gets inflamed, it causes a lot of pain. Once again, as I mentioned a minute ago, pain causes inhibition of those muscles that actually affect it, or they are surrounding the area, so therefore your spine is going to be left on a naked state. We call it naked because there's nothing supporting it. It's pretty much by itself, and the spine without all those muscles, tendons, and ligaments functioning properly, it becomes really, really unstable.
By the way, probably the second part we're just going to do about how exactly the back stability comes into play.
Oh, we're going to do...
How do you exactly do the back stability?
We're going to do subsequent episodes where we actually mention more in detail, and we'll tell you more things that you can do about it to just get better.
Two more things that I want to specify. The back pain can be driven by age. Older that you get, the older we get, brother, there's a higher chance of having back pain. Even though me personally, I had a back pain for 10 years when I was younger, and I don't have any back pain right now, no I will ever have. I'm going to work on it very hard.
Absolutely.
So, talk a little bit about age.
Age. Well, it's just another number. It's actually the chronological and biological, predisposing of the body to all the elements and all the stressors. Now, it is a well-known fact that males and females, humans, from the age of around 35, 37 to actually 45, 47, they're more predisposed to actually back pain. Why exactly? We don't really know, but that's the age where people are usually the most active. Let's be realistic. When you work in the hottest, where you pretty much putting your life in perspective, and that where you're taking the most amount of chances.
Or it could be it's just an accumulation of factors of living that long and accumulating a lot of bad habits.
Absolutely.
By
you
the
hit
time you hit 30,
the nails right on the head.
Yes, we start getting it.
So at certain ages we're more predisposed to pain, like at certain ages when we get older we're more predisposed to osteoporosis, different things. The ages to actually have back pain is from 35 to 45.
Another biggie is a violent trauma, something that in a lot of cases you cannot avoid if it happens. Some sort of car accident or accident, it just happens. So I guess there's nothing you can do for the fact that it happened, but there's a lot you can do after the fact that it happened. What we want to make sure that you get from this episode, that there is help for back problems on this planet, and it's very much possible to fix your back in a high percentage.
Absolutely. And we have the tools because our record, shows that we have worked with hundreds of patients with back pain, and we have made them just about all of them, I will say close to 99% better, much better. As a matter of fact.
It will be quite a work, but nonetheless, it is possible to recover from this kind of debilitating condition. Anything else you want to say?
Well, the one thing that I would like to mention is that if you yourself have back pain, or if you know somebody that has back pain, which I'm sure you do because it's very prevalent in society nowadays, please forward them this episode. I think it will be very important to them. We just want to actually just pick your interest and begin to create a series of a few episodes where we'll give you lots of good information, very good detail, and exercises and other things that you must do in order to overcome your back pain and feel better once again like you were when you were in your teenage years or your early 20s.
Absolutely. Remember, guys, your future looks better already. If you share this episode with your friends and family, their future looks better already too. Thank you very much for watching, and until next time.